Welcome in, everybody, to the My Pets Wellness Weekly Wellness Podcast. My name is Kevin Crispin. I'm the Chief of Staff at My Pets Wellness. I am here with our veterinary ambassador, Dr. Rebekah. Dr. Rebekah, how are you doing today?
I'm doing great. Kevin, how are you?
I'm hanging in there. Thank you very much for asking. Okay, so today on the podcast, we're going to talk about the first year out of school. And something I repeat over and over again on this podcast, but it's true. It starts like this. What I've learned working with vets is that it's an especially challenging time. So let's start with this. Tell us about your first veterinarian job outside of school and what that was like and kind of your experience.
Yeah. So right after school, I actually got a position as a research fellow at Berkeley. So I spent a full year after clinical rotations doing that. So that kind of prefaced my first year as a practicing veterinarian. My first position was actually as an associate at a small animal hospital in California.
Okay.
And because I had been out of veterinary medicine for a full year since I graduated, I hadn't really touched an animal besides my own in that time. I was really looking for something that was heavy in mentorship because I knew that to get up and running after that lag, I would, maybe need a little bit extra support. And so I signed with a position where, I was guaranteed 6 months of intense mentorship to make sure that I was comfortable.
That was part of the job that you took.
That was part of the job that I took.
Got it.
And so I felt really fortunate, the first several months, 3-4 months that I was there, I got, I would say, very high quality mentorship. I was able to learn directly from, the head veterinarian that was there, the medical director. And I felt like that learning curve, even though it was very, very steep, I had help in climbing it. So I felt really fortunate by that. After the first couple of months that I was there was actually a position that opened up at one of their other hospitals that needed a primary veterinarian.
Okay.
So I went after 3 months of practice to being the sole veterinarian at this practice that had actually been established in the community for 30 years. So it had
an
extensive client base. It had a lot of really loyal patrons and excellent clients, but it was in the process of being acquired by my organization.
Gotcha.
So there were some growing pains there. The veterinarian who had been there for 30 years was in the process of retiring. And so I came into this practice having been out for 3 months at this point.
Yes.
And not only dealing with the difficulties of practice, but also with the process of transitioning, from a certain way of practice to what I would say is a little bit more of a modern veterinary practice.
Yeah, and that established clientele for 30 years, bringing in members of your family, really.
Exactly.
And you get to know. That had to be a very specific challenge and everything.
It was. And I thought it was a good experience too. The time that I was there, I saw a ton of different, very complicated cases that because it was so busy and because it had such an established client base, I had the opportunity to see these things that I honestly didn't expect that I would see out in the first couple of years of practice. I saw a ton of cases of these kind of more rare disease processes. And so I thought that was a really good learning experience. And then I also, having been thrown into it in a way, I felt like it was a way to kind of, sink or swim, but it was a way to improve my communication skills in a very acute way. Like, you are taking over this practice and, introducing a more modern and maybe a different way of practicing medicine.
Okay.
And so you have to be able to communicate with the clients. This is why we're doing it this way. And this is why we're transitioning. And, I'm recommending this because. So it was a great learning experience, but I would say it was a lot of pressure.
I would say so. A lot of pressure, but such a, it sounds like you had a really good plan on how to do that. Communication being the key there, right?
Exactly.
So do you think that most vets, do you think that they struggle with their first year in practice outside of vet school?
Absolutely.
Okay, why do you think that is?
I think there are a lot of different factors to it. Part of it is, you graduate from vet school with this idea of the ivory tower. You have in your mind, if this patient walks in with XYZ condition, I know exactly what I'm going to do. I'm going to do this particular diagnostic. If I get this result, this is the treatment that I'm going to go with. So part of the struggle is you graduate with all of these ideas of how you're going to practice. You get to the real world and it turns out, oh, you have $100 to your name. Okay, let's talk. Let's prioritize. How do we manage this?
Yeah, that is. Now, can I ask you something? In vet schools, that's something that they prepare you for, train you for?
I think that they touch on it. It's difficult to really train you for it during clinical rotations because you are at a specialty referral hospital. You're seeing the rare cases that have already been seen by the general practitioners.
Good point.
So you're really, you see this very small selection of cases that are coming to you because that's the expert, So I feel like they're able to speak to the fact that you're going to have those challenges, but it's hard to actually witness it in your rotations. So you kind of know about it, but until you live through it, it's a totally different experience.
Yeah, I bet. So if you could go back in time in a time machine and talk to yourself in that first year, kind of maybe focusing on when you took over that very established practice, what would you tell yourself that you think would be helpful?
Oh, that's a good question. I think I would tell myself, be a sponge.
Be a sponge.
Because everything that you're going through in your practice during that first year, it's challenging. And at some points you might ask yourself, can I actually do this? I don't know if I'm cut out for this. That I feel like is a really common feeling of kind of imposter syndrome. Oh gosh, what did I get myself into? Am I actually prepared? But despite that, I feel like there is so much learning to be done in that first year that really, get out of your head and really be open to that experience and understand the first year is universally hard.
Yeah.
Everybody struggles with it. And kudos if you don't. I mean, tell me your secrets. But but everybody has difficulty with that transition for a number of different reasons. And despite that, you have this opportunity to go out there and learn and absorb all of these things. And, even if you don't do something right the first time, take that opportunity and learn from it. Embrace that.
Yes, so true.
So,
and yes, that's so true because, mistakes are they're an opportunity to learn.
Exactly. And in veterinary medicine, the stakes are a little bit higher.
You're right.
I'll say some of the mistakes, that clinicians can make, they are life and death. So it's one of those things that it is hard to just say, mistakes happen, learn and move forward. But ultimately, it's good to remember we're human first. So those mistakes are going to happen. And so, yes, you can be upset about them and you can embrace that fact that you are disappointed in the outcome. And you can, kind of sit with that and understand it and then also learn from it. So I'm not saying that it's just you just learn from it and you get past it, but it's a dual process. So be a sponge and be open to feeling the full range of feelings that you're going through and really be open to, exploring your path in veterinary medicine. And if you find something that you're interested in, pursue it. And if you find something that's difficult, embrace that and learn from it. So,
yeah. Okay. That's awesome. So then finally, tell us about the My First Year initiative here and why you think it's important.
Yeah. So the My First Year initiative with My Pets Wellness is basically a library of resources that are for fourth year students and for newly practicing veterinarians. Okay. So new grads that are in their first couple of years. And it's basically this library that includes a lot of different just anecdotes and resources as far as, files with tips and suggestions. It's veterinarians who've been there and veterinarians who've experienced this first year, experience that everybody goes through and speak to that. So they're able to give their tips and their thoughts and resources that you can access for, how do you get through the first year? And really, what is it like for other people? So when you're asking yourself, you feel like imposter syndrome and you're like, is this really for me? Did I do something wrong? What am I doing here? I'm not, able to be here, you can look at these videos and see, oh, actually, that's a really common feeling.
You're not alone.
You're not alone.
Yes. It's something that we talk about a lot in the safe space that we're trying to create.
Yeah.
So, and if anybody can go and take a look at the My First Year initiative, right?
No paywall or anything. Like everyone, it's meant as a way, to give back to the veterinary community and to really help veterinarians who are struggling, which, a lot of times 4th year vet students going into their first position, people out there in the first couple of years, it's hard and we get it. So it's really a resource meant for those individuals and even people who've been out in practice longer if you want to take a look at it.
Yeah.
But yeah, it's really meant as a gesture of goodwill for people to be able to access resources.
That's great. That's really great. Well, thank you so much for being here today, Dr. Rebekah.
Always my pleasure.
Yeah.
Thank you.
And thank you everybody for tuning in. You can learn more about this at mypetswellness.net. And we'll be back next week. But until then, I hope you take care. Bye-bye.